Good afternoon, Mr. Chairman, members of the committee. My name is Laura Tamez, and I'm the president of the Texas Trial Lawyers Association, and I am here on their behalf testifying respectfully against the bill. I want to start out by thanking Chairman Frank for involving involving TTLA in the process, asking us for language, see how to make the bill better. I've heard some good things today toward that goal. But the couple of things I wanted to share, and I'll be as brief as I can, is the concern was the access to health care for injured victims, those who may have been involved in a crash or a work injury and sued due to the negligence of another. There are already some physicians who don't treat accident victims. They'll just say, then I'd have to insert myself in the litigation, give a deposition, testify at trial, and there are some who do. And luckily in the common law, there are already some guardrails to ensure that what physicians charge are, number one, usual and customary charges within the community. They have to defend that, and that their charges are reasonable and necessary. So they submit themselves to cross-examination. The insurance defense lawyers can hire billers and coders to challenge the charges, and then it's within the province of the jury to determine the reasonableness and necessity of those charges. That's for the treaters. As for the hospitals, due to the good work of the House and Senate last session, hospitals can charge or file liens in the event there is an injured victim who shows up at the hospital who is uninsured. Yes, the charges will many times be at the charge master rate. Once they file the lien, then the patient is responsible for the charges. However, due to a bill that Senator Hughes carried that now lives in the property code, that hospital, to make the patient whole, in the event that the charge is going to be submitted to the jury, and that line item, the actual number, can be submitted on the jury charge, and the jury decides to go ahead and compensate the patient for that hospital charge that is already a lien that they are responsible for, then the hospital has to pay reasonable attorney's fees and expenses, which ends up being a reduction in the lien, and that is the goal, to make the patient whole. So those are the guardrails, or an example of the guardrails that already exist in the common law. So I'm happy to answer any questions and continue visiting on how to make the bill better.
Thank you so much. The chair recognizes Chairman Frank.
Thank you very much. I do appreciate y'all meeting. From the start, we met a month ago, and when they left, they said they could find a way to carve y'all out of the bill, because that's not, the frustrating thing is we're going to keep from protecting a bunch of people, basically to make sure that the trial lawyers can continue to do this process and protect a very small group, a very important group, but to protect a very small group of people that get in an accident. And I've talked to tons of members on the floor that said, absolutely, we can carve out. And to date, I'm like, how do we have so many smart trial lawyers and we can't figure out a way to, we cannot figure out a way to carve you out, because I understand the need to take care of somebody and the need to frankly pay more for the risk that is being incurred by the doctors and the lawyers in taking care of those uninsured patients. I don't see why you can't figure out a way. I'm not smart enough to do it, but I think as lawyers, I hope that y'all can find a way to do it, because frankly, you are letting the needs of a couple keep from protecting a whole lot of people. Because honestly, I get it, it's in y'all's best interest, it's in TTLA's best interest, or the trial lawyer's best interest, and even the uninsured accident victim's interest to have a really high medical cost. But it is not in the best interest of the 99.9% of the people that are getting these bills. And I just would love, I guess I beseech you and ask a couple of my members that have better relationships with them, please help me get y'all out of this. Thank you.
Members, any other questions? Yeah, the chair recognizes Representative Wally.
Just a quick question, Ms. Tamez, though, I guess to address the issue of the high medical costs.
Right.
I don't, just been my experience that it's in nobody's interest. The patient, the firm representing the patient, you want to get them care, you also want to reduce those fees. Is that correct? The medical costs, I guess.
That is correct. And sometimes to make the patient whole, the providers have to reduce what they have charged, and that is part of it. So yes, at the end of the day, that is correct, is trying to make the patient whole. The concern is that we don't want to deter more physicians from accepting injured patients. I will say that perhaps looking at the language of the usual and customary charge that's already in the common law, or the language of reasonable and necessary, is something that we can further discuss, and I'm happy to work with Representative Frank in that vein.
No, thank you. And I know, I mean, I know there's nobody wants to have high costs. You want to be able to represent those folks the best way you can. You know, I know just from personal experience, you work hard to get those medical bills reduced at all costs, because obviously that puts more. The theory is that you would put more, you would make that patient more whole by putting more resources into the pocket of that patient that's been injured. Is that not correct?
That is exactly right, Representative Wally.
Thank you.
Thank you for the question.
Members, any other questions? If not, thank you for your testimony.
Thank you.
At this time, the chair.